So many patients ask, or at least wonder, what makes a qualified practitioner, and in particular in the non-surgical realm. I think it's a bit easier with a surgeon, as you can assess their qualifications, you can look at before and afters posted all over the place, and make a decision based on that. With non-surgical treatments, those are injectables, Botox, and fillers, as well as skincare treatments like microneedling or radiofrequency-based treatments. It's an unbelievable market out there where people are doing all kinds of things that they may or may not be trained to do, or may or may not be particularly good at. And so the focus of this video is really how to assess or determine if that practitioner is appropriate for the treatment you're looking for. I think there are three areas that you need to seriously consider. One is the training and experience of the practitioner, and that can be by asking directly, it can be by looking the person up, and you want somebody that's, of course, well trained and has been doing this for some time and has experience. I think the third part of that is access to that person. We all know that any place that you're going to go have a treatment of any sort is going to be available when you need that treatment, but the question is, how available are they going to be after your treatment? And that's really when you rely on that practitioner. That's what differentiates the people interested in treating versus looking after patients long term. I'd say individualized care is another very important factor. So you want a place that's going to spend the time to talk to you about your goals and expectations, about issues that you've had in the past with various treatments or with your skin in general, and develop a plan that's specific to you. What goes along with that is that practitioner having access to a wide range of technologies and treatments, and maybe even surgical options if necessary. Again, you want to know that the plan that's being designed for you is one that takes into consideration every available option, again, surgically and non-surgically. If you go somewhere where one treatment is available, you may be offered that treatment even if it's not necessarily the ideal treatment. And finally, and again, maybe the most important, is that you feel comfortable. From the moment you make that phone call and try to make your appointment, and you ask some of the staff, the receptionists, questions, you need to feel comfortable that you're going to be looked after. And then certainly when you come in to see the practitioner, you need to feel completely comfortable in what they're suggesting, in their experience, and in how they're going to look after you. The way we've set up our practice is that our ecstatic nurse injector, Milena, is in charge of and really spearheads our non-surgical practice. I'm about as involved as one could possibly be in this process. I'm involved in training, I'm involved in supervision, I see patients on a regular basis, but really we're a team that ensures that patients have a comprehensive assessment and are given all the options, as well as being or making sure that patients have access to whatever they need after their procedure, which again is extremely important. And so I look forward to your comments or questions. If you want to come in to talk about any of this in more detail, or you want to come in specifically for a consultation, we'd love to see you. Looking forward to it.